This video is the first of many videos where we'll be reviewing past questions. Please follow for more videos like this, and I would love you to comment part 2 if you would like a second part. In this video, we're going to be going through 20 past questions which I shared on my Telegram group last month. First question is, which of the following would be a sign of an infection? A. Muscle aches. B. Headaches. C. Fever. D. Nausea. The obvious answer there is fever. There's no need to think about it twice. Fever is a telltale sign of an infection. Question number 2. Streptomycin antibiotic was discovered by A. Alexander Fleming, B. Waxman, 3. Frankel, D. Neisser. Now the answer is Selman Waxman, and he discovered it in 1943. Keep that in mind. Selman Waxman in 1943. Next, what is the first line of defense in an immune response? Which is basically the first way your immune system will protect you from an antibody or bacteria. The options include A. Anatomical, mechanical, and chemical barriers. Option B is B and T lymphocytes. Option C is antibodies. And option D is macrophages. The answer here is A. Anatomical, mechanical, and chemical barriers. Some of these barriers include our skin, mucous membranes, secretions like saliva as well. So these are your body's first immune response to antibodies. Next is pertussis or whooping cough is caused by dash. A. Bordetella disease. B. Parvovirus. C. Herpes disease. D. Varicella zoster. Now, the answer to this question is A. The Bordetella disease. Bordetella will cause whooping cough. Question 5 now. A 5-year-old is being treated for enterobiasis, also known as pinworms or threadworms. Which symptoms is associated with enterobiasis? Option A, rectal itching. Option B, nausea. Option C, oral ulcerations. Option D is scalp itching. And the answer to this is rectal itching. You can also notice vaginal itching as well when it comes to pinworms or threadworms. Question number 6. Which of the following is commonly associated with host defenses against parasitic infections? The options are neutrophils, basophils, eosinophils, and macrophages. And the answer is C, eosinophils. Now, if you would like a follow-up video, comment part 2. Question number 7. Who discovered the antibiotic penicillin? A. Alexander Fleming, B. Edward Jenner, C. Waxman, D. None of the above. The answer to this question is Alexander Fleming, and he discovered it in 1928. Next question. A clinical instructor, this is question 8. A clinical instructor is providing teachings among nursing students about the stages of pertussis. Which of the following is the final stage of pertussis infection? Now, this question is actually not on a disease, but they're asking you about the stages of an infection. So they ask, what is the final stage? Now, if you remember stages of an infection, the final stage is convalescence. Now, let's see the options. A. Paroxysmal phase. B. Recovery phase. C. Catarrhal phase. D. Convalescence. Convalescence is the answer. It's the final phase. Next is, at what temperature do bacteria grow that could cause food poisoning? Option A says 4.4 to 60 degrees Celsius. B says 1.7 to 3.8. C says 15 and 49 degrees Celsius. D 10 to 54.4 degrees Celsius. The answer to this question is A. If you look it up, you'll see that bacteria thrives between 4 to 60 degrees when it comes to food poisoning. Question number 10. Mosquitoes are often seen breeding on stagnant water. We should not allow mosquitoes to breed in our surroundings because they A. multiply very fast and cause pollution. B. are vectors for many diseases. C. they cause bites and skin diseases. D. they are not important insects. The answer here is option B. Mosquitoes are not to be allowed to grow because they are vectors for multiple diseases. Question number 11. What is microbiology? It is A. the study of molecules that are visible to the human eyes. B. study of animals and their families. And the next one says study of organisms that are not visible to naked eyes. D says study of microscope. The answer is obviously the study of organisms that are not visible to the naked eyes, which is option C. Option number 12. Pathogenic organisms are those that are dash A. Capable of producing diseases, B. Extremely small or visible to the naked eye, C. Harmless to the body tissues, D. Capable of producing an allergic reaction. The answer to this question is option A. It is organisms that are capable of producing diseases that are known as pathogenic organisms. Question 13 says, the epidemic that infected Europe, Middle East, and North Africa and killed tens of millions of people were known as the Black Death. This disease was caused by dash A. Anthrax, B. Breathing of foul air, C. Bubonic plague, D. Smallpox. The answer to this is the bubonic plague, which was caused by an infestation of fleas. I will make a separate video on this. That's why you need to follow if you are not already following, or subscribe if you aren't, because I will keep dropping videos like this from time to time. Question number 14. Which of the following is an example of a non-communicable infectious disease? A. An infection with a respiratory virus. B. Food poisoning due to a performed bacterial toxin in food. C. Skin infection acquired from a dog bite. D. An infection acquired from a stick of a contaminated needle. The answer to this question is food poisoning. Food poisoning is a non-communicable infectious disease. Next is number 15. Bacteria are classified as dash A. Molds, B. Yeast, C. Plants, D. Animals. The answer in the book was plants, but I looked it up. Bacteria are prokaryotes. They are not plants or animals, but then they were formerly classified under plants. So I guess it's safe to put plants if you don't see prokaryotes in the options. The nurse is aware that a common mode of transmission of Clostridium difficile is A. The use of unsterile surgical equipment, B. Contamination of objects with sputum, C. Through urinary catheterization, D. By contaminations of objects with stool. The answer to this is obviously contamination of objects with stool. If you scroll a lot, you should see a lot of people making jokes about C. diff. This bacteria is usually found in the colon, and it's caused by killing the normal flora of the colon. Which of the following is not an infectious disease? A. Dengue, B. Scurvy, C. Typhoid fever, D. Whooping cough. The answer is obviously scurvy. Scurvy is caused by a deficiency of vitamin C. It is a nutritional deficiency and not an infectious disease. The next question says, Nurse Richard is handling a child with pertussis. During the assessment, the nurse will observe which of the following characteristics of the child's cough? A. A sour cough, B. A chesty cough, C. A hacking cough that ends with a whooping sound, D. A barking painful cough. And the answer is obviously option C, a hacking cough that ends with a whooping sound. Note that pertussis is known as whooping cough. Now the last question in this video, the shape of the streptococcus is best described as dash A. Spiral, B. Rod shaped, C. Oval, D. Spherical. The answer to this question is D. Spherical.